You know, I'm doing next semester. It won't matter to some of you. I'm putting those take-homes online, so you got to do it online. That way I don't have to grade them. It's graded automatically.
That makes sense.
Right, you haven't done that yet.
Yeah.
That's a lot of work. You can't just copy it. Yeah, you got to type them, retype all the questions.
Every
Every
year.
year.
Have a TA for. What they have,
For
Yeah.
300 points, I'll type it for you.
right?
I might take you up on that. But then you know the answers
I'll
too.
go for 200.
All right. You should have a show. Extra credit show. I'm willing to change Tim's oil for 50 bucks.
You can get so much stuff out of that. You couldn't do anything.
Right. I'll go grocery shopping.
That's what I was gonna say.
Okay, here we go. Ready? Oxyhemoglobin dissociation curve. Let me explain this to you first. All right? Write this down. I'm not writing anything tonight. You are. I'm just going to say it.
Are you recording?
Yes. All right? Watch. There is a phenomenon with respect to red blood cells. And that phenomenon is this. When an oxygen molecule binds to an iron on hemoglobin, it makes other oxygen molecules bind easier to hemoglobin. Do you understand that? It just makes it easier because this is what produces the sigmoidal shape in the oxyhemoglobin dissociation curve. If that wasn't the case, the curve would be linear. You got me? So watch. If the curve was linear like this, and you went up to Devil's Point in La Crosse, right? The PO2 up there may be 80, so your hemoglobin saturation would drop to 80%, roughly. That's a straight line. And you would really be struggling. But if you look, now watch, you can drop to PO2s of as low as 70, and you can still saturate almost 95% of your hemoglobin. That's due to the fact that when one oxygen binds to the iron on hemoglobin, it makes the other ones easier to bind. Do you follow that, guys? Okay. Now, we went over PO2 and PCO2 and all that stuff. All right, so this is how you interpret this curve. Watch it. What's the PO2 of the atmosphere at sea level?
76, 79.
Partial oxygen?
It's 100, right? So at 100, what's the saturation of hemoglobin? Just look at the blue line for now.
95.
Yeah, it's like 96, 97. Okay? I'm closer, I can see the numbers. You got me?
Yeah.
What's the PO2 inside a cell?
100.
No, that's in the alveoli.
Oh. 40.
It's 40. So watch. The PO2 is 40. So draw up a perpendicular. And what's the saturation of hemoglobin at a PO2 of 40? About 75, right? So is there still oxygen in venous blood?
Yeah.
Right, that's an example to show you. So basically what has happened is you've lost 25% of your hemoglobin, or of your oxygen. Do you see that? Right? Now, watch. If the PO2 begins to drop, now let's say the PO2 is 70 because you got some kind of lung disease, like non-book reading lung disease. If your PO2 is 70, what's the saturation of hemoglobin?
90.
Right. About 90. So as the saturation of hemoglobin begins to drop, now you have to get a 25% reduction, right? So if it's about 90, you have to bring it all the way down to a PO2 of here. So the PO2 drops to 30. Do you follow that?
When it's back in the venous.
Right. So the venous blood here to get 25% reduction in the oxygen delivery, now the saturation of hemoglobin is 65%. Now watch. What did I tell you? I told you that the more oxygen that's bound to the iron on hemoglobin, the easier it is for others to bind. So if your PO2 is low, then that means your venous blood is going to have a lower PO2 and a lower saturation of hemoglobin. Do you follow that? So when this venous blood now with the lower saturation of hemoglobin goes to the lungs, it's going to be more difficult for the oxygen to bind. Tell me you got that. That's where supplemental oxygen now is important. So if you give them supplemental oxygen enough to bring their PO2 up to 90, right? The saturation here is like 95, and the PO2 inside the cell is going to be a little less than 40 in order to get it to that 25% reduction. Do you follow that? No or no? Why not? All right. Well, that's being recorded. It's good. Do you follow this a little bit, guys? Okay. So this is what I really want to explain to you. All you need to know, first of all, a PO2 of 60 or less makes it very difficult for a person to live. They will have symptoms. They will be short of breath. They will be cyanotic, right? And what does hypoxia do to breathing? Lack of oxygen? It's going to stimulate breathing, right? So these people will be breathing faster and deeper, right? Trying to get extra oxygen. But look at if the PO2 is 60, then your saturation is about 82%. Now watch. After a PO2 of 60, to get that 25% reduction in hemoglobin, so it's 82, right? So you have to bring it all the way down to like here, right? So what's the PO2 going to be? The PO2 is going to be 25. So that means the cells are going to be starving of oxygen. Who's with me? All right. Okay. When I learned this, right, I'm like, what the hell is this guy talking about? Right? But I didn't understand the stuff that I went over with you, so it should make perfect sense. Everything I'm about to tell you, you have learned, and you should be able to put it together. All right? Now watch. Where do you want the oxygen to bind to the iron on hemoglobin? Where in the body do you want that to happen? At the alveoli and the pulmonary capillary. Where do you want the oxygen to let go of the iron on hemoglobin?
Cells of the body.
At the systemic capillary and the cell. Do you got that? All right. Write this down. You shouldn't have to write this down. You should know it. I'm not going to write it down. You're going to write it down. Ready? What are the byproducts of metabolism? CO2, heat, ADP, H2O, forget that, hydrogen ions, and? What?
ADP.
No, she said that. Come on.
Wait, what did we say? We said heat, ADP.
Now I have to write it down. Now don't. Now I'm taking points away.
Hydrogen. We said them all.
Whatever. No. I know, I listen. One more. Very good. Hypoxia. Ah.
Same.
What do those do to the arteries that supply those body parts? They dilate them. Now watch. Where do you want to deliver the most oxygenated blood? To the most metabolically active parts of the blood. Are you with me? Here we go. Want this whole thing. Whole thing. Whole thing. Whole thing. What do I want? The whole thing. Oh, you know. Oh yeah. What's that? You know what? Yeah, I'll give you that.
Red blood cells.
Yeah, because I made it red. A lot of times I make them yellow, though. So I see the confusion. What's this? That's hemoglobin. It gets smaller and smaller throughout the respiratory discussion. All right, what's that? Good. What's the PO2 of venous blood? That's very good. What's the PO2 of the alveoli?
100.
That's right. Can you see this color? Yeah. Oh, that's a nice looking color up there. 100. Say yeah. So what's going to happen to the PO2 of this blood by pressure? What's going to happen to the PO2 of the pulmonary capillaries? It's going to go up. Tell me you got that, right? So you better write this down, better not pout. One of the conditions at the lungs is high PO2. High PO2 makes oxygen want to bind to the iron on hemoglobin. Say yes. What's the PCO2 of venous blood? 45. You guys are legends. No one's ever remembered that. What's the PCO2 in the alveoli?
40.
Right, because where do you want the CO2 to go? Right, I know where you want me to go. Ready? So, what's another condition at the pulmonary capillary? Low PCO2. Say yes. Low PCO2 and high PO2 make oxygen want to bind to the iron on hemoglobin. Where do you find those conditions? In the lungs. Only makes sense. Say yeah. Where does all this newly oxygenated blood now go? Wait, it's in the lungs. Pulmonary veins.
Oh, left side of the heart.
Yeah, there you go. Left atrium, right? Left ventricle, and then it will pump that blood down to the cells of the body. Where's the vast majority of that oxygenated blood going to go? You said it before.
The cells of the body.
The most metabolically active cells, right? Tell me you got that. What's hemoglobin?
Protein.
It's a protein. And we learned that proteins are...
Temperature and pH sensitive.
That's so good. Here we go. So watch. As that blood matriculates through the arterial system, it is going to come down to the cells of the body. What's going to happen to the temperature of that blood as it gets closer and closer to those metabolically active cells? It's going to go up. What's going to happen to the pH of that blood?
Go down.
Why will it go down?
Because it's getting rid of the oxygen and taking out the CO2.
And we learned that CO2 is an acid, didn't we? And what are the byproducts of metabolism? Please tell me. All right, you got, yeah, you know, it's like you're in church, you know, okay, right? Carbon dioxide, hydrogen ions. So the pH of that local blood at the systemic capillary in the cell is going to be lower. What's the PO2 of arterial blood? 100. What's the PO2 inside the cell? 40. Tell me you got that. So the oxygen by pressure is going to leave the plasma and go into the cell. So what's going to happen to the PO2 of the blood as it gets to the systemic capillary in the cell? The PO2 is going to go down. So you have low PO2, you have elevated temperature, and you have a lower pH. The lower pH and the higher temperature change the shape of hemoglobin, and it will not allow oxygen to bind to the iron on hemoglobin. The oxygen falls off and goes into the cell. Do you follow that? So, red blood cell, hemoglobin, made that one pretty good. We know there's 4 irons in each hemoglobin, right? And then as the blood gets to the metabolically active cells, the temperature is going to go up, the pH is going to drop. What's the PO2 going to do? Drop, because the arrow went down. And what's the PCO2 going to do? What's the PCO2 inside a cell? 45. What's the PCO2 of arterial blood? 40. So the PCO2 is going to go up. Say yes. Who's with me? So what are the conditions you have at the cell? High PCO2, low PO2, increased temperature, and a lower pH. All of those will change the shape of hemoglobin, and it will prevent oxygen from binding to the iron. It will dissociate from the hemoglobin, and it will go into the cell. Say yes. Now watch. Let's say you decide to go running. You got me? If your cells become more metabolically active, do they need more oxygen instead at the end of the electron transport chain?
Yes.
So what's going to happen to the PO2 inside the cell when you start becoming more metabolically active? You're using the oxygen. So it'll go down, right? So if you're using more oxygen, right, PO2 inside the cell is going to go down. Do you see that? What's going to happen to the PCO2 inside the cell? It's going to go up. What's going to happen to the temperature? What's going to happen to the local pH? And those byproducts of metabolism, the more you produce, the more the arteries will dilate. And if more arteries, they dilate more, then when the left ventricle contracts, more oxygenated blood is going to go to the metabolically active areas. Say yes. And because you're producing more byproducts of metabolism, the PO2 inside the cell is lower and the PCO2 is higher. That's going to change the shape of hemoglobin even more and unload more oxygen. So it should be clear to you, crystal clear, that metabolism dictates your physiology for the crowd. Do you see that? Yeah. And if you followed our little 15-week program, you understood that completely. See, that's how oxygen delivery to the cells is determined. It's determined by metabolism. Say yeah. Get this right, and I will give you a swig off this Kirkland sparkling water that I've swigged on a while. Where do all the veins of the body dump their venous blood? Come on, say it with a little more pep. That was a little more pep. The right side of the heart. That's right.
That's the question that got us filled out the diamond do.
Yeah. It's Kirkland Sparkling. It's lime.
Oh.
You're gonna have it when there's just some in the little bottom part there. Oh God. The other day, you know what I was doing? I was counting the number of classes I have to teach before I could retire.
What's that number look like?
It's 24.
So that's blue words.
No. Oh wait, no, not 24. Wait. No, 48. That's a lot. I may have to retire sooner. Did I tell you in April I'm meeting with my retirement lady? Maybe she'll tell me. Tim, if you don't eat, you can retire. I'll think about it. Here's the video you love to hate. Here we go. Ready? Where do all the venous blood go? To the right atrium. Say yeah. Watch it. How many people had a cup of coffee this morning? Okay. If your coffee is really hot, besides blowing on it, what could you do to it? You could put an ice cube in it. Yeah. Write that down. How many people put an ice cube in their coffee this morning? No? You could have got major extra credit if you would have done that. Too late now. You already told me. Okay, watch. Where do all the venous blood go? I'm drawing arrows. The right atrium. Ready? Now watch. That warm blood, that much warmer blood from the metabolically active parts of the body, say yes. That says metabolically active. It's going to mix with the cooler blood, relatively cooler blood from the metabolically inactive parts. So what's going to happen to the overall temperature of the blood as it gets into the right atrium? What's going to happen to the overall temperature? It's what? Yeah, it's going to go down, right? Where does all that blood get pumped to? I'm drawing the arrow. The lungs. What do you do in the lungs? You do what? You gas exchange. I gas exchange right before class. Ready? Watch. What's going to happen to the PCO2 of the blood in the lungs? What's going to happen to it? Is it going to go up or down? When it's in the lungs. The PCO2, wait a minute. The PCO2 is 45.
Yeah. So it's gonna go.
It's gonna right. Look at the arrow. Right. It's gonna go into the alveoli. So what's gonna happen to the PCO2 of that blood? And we learned that CO2 is an acid. So watch. What's going to happen to the pH of the blood? It's going to go up. So in the lungs, watch it. You got higher pH, lower temperature, high PO2 and low PCO2. All of those conditions cause oxygen to bind to the iron on hemoglobin. Do you see this? How many people follow this? How many people have no idea what Timmy's talking about?
You're doing the oxygen transporting around, right? Makes sense.
Guys, how many people followed that?
He's doing 5.
I'm doing the oxyhemoglobin dissociation curve, and all of the questions. That's right, because all the questions are related. Yeah, you know what? If this light was a ray gun, right, you'd have a big hole in your head right now.
Oxyhemoglobin, but that isn't even.
The oxyhemoglobin dissociation curve.
Oh.
Yeah. Oh, tell me you got that. Guys, yes or no?
Yes.
I want that whole thing. What you're going to do is you're going to describe for me the conditions at the lungs and what happens to oxygen binding to hemoglobin, and then you're going to tell me what happens at the cell and what those conditions are and what happens to oxygen's ability to bind to the iron on hemoglobin. Do you follow that?
Yeah.
Okay, watch. One of the things you're going to have to learn in clinical, right? And you're just going to have to learn this. That's just the way it is. What they do is they talk about right shifts and left shifts in the oxyhemoglobin dissociation curve. I know. The words itself probably scare you, right? I'm willing to give 200 extra credit points right now if you will legally change your name to oxyhemoglobin dissociation curve. It has to be the whole thing. Can't be oxhem dis curve. No? All right, watch. I'm going to simplify it first, then I'm going to explain it. In a right shift of the oxyhemoglobin dissociation curve, what that means is that for any given PO2, hemoglobin saturation is lower. Let us observe, right? Pick a PO2, any PO2. Oh, pick a PO2 of 70, right? The blue solid line represents normal conditions. What's the PO2? What's the hemoglobin saturation at a PO2 of 70?
90.
It's about 90, right? Now look, if the curve is shifted to the right, what happens to the hemoglobin saturation? It's lower. Tell me you got that. So what this means is when you get a right shift in the oxyhemoglobin dissociation curve, you have for any given PO2, you have a lower hemoglobin saturation, and oxygen will let go when it gets to the cell. The problem is that it won't bind in the lungs, because when you shift the curve to the right, you have conditions all over the body that are normally present only at the level of the cell. What conditions do you have at the cell? You have low PO2, high PCO2, elevated temperature, and a lower pH. So all of those conditions are going to cause oxygen's ability to bind to the iron on hemoglobin to be less in the lungs. Tell me you got that. You'll look it over and you'll get it. Right? So watch. If somebody has a fever, how do people breathe when they have a fever? Faster. And the reason they breathe faster is because of fever. How many people ever got a fever in their thumb? Chris did. No extra credit though. When you get a fever all over, right? So the blood's gonna be warm all over. So what is that gonna do? That's gonna shift the curve to the right, and that means that oxygen will not be able to bind to the iron on hemoglobin in the lungs. So the overall saturation of the hemoglobin is going to be lower.
So is that red line like it's your temperature?
No, the red line is the shift in the oxyhemoglobin dissociation curve. All I'm telling you is that when it shifts to the right, you have conditions that are found in the cell. And that for any given PO2, oxygen's ability to bind to the iron on hemoglobin is less. So you're essentially delivering less oxygen to the cells of the body. You got me? Watch. A shift in the to the left means that all over your body you have conditions that are similar that are found in the lungs. What do you find in the lungs? You find a lower temperature, a higher pH, a higher PO2, and a lower PCO2. And all this is telling you is if the curve shifts to the left, oxygen will bind to the iron on hemoglobin, but when it gets down to the cell, it won't let go.
You mean like left closer towards zero?
Yeah, no. See how the curve is shifted to the left? The green curve, it's shifted to the left. Right? Here's the normal curve. Here's the right shift, the red dotted line. And then the left shift in the curve. Do you see that?
Okay.
So all I'm... Watch. If somebody's body temperature is low, do you want to be giving them a lot of oxygen?
No.
No. Here's why. If you give them more oxygen, it will prevent oxygen from letting go of the iron on hemoglobin. Do you understand that? So that's why, depending on the person's condition, let's say they have a really high fever, you need to give them more oxygen because you need to pump up the PO2 in order to, when you pump up the PO2, it makes oxygen bind easier in the lungs. It has no problem letting go for the most part, but it won't bind in the lungs. Do you follow that?
So can you die from having too much oxygen?
Yes, you can. It's called oxygen toxicity. Oxygen is not good for you. It isn't. You've heard of oxygen radicals? Free radicals.
Oh, yeah.
You've heard of, those are all the result of oxygen. Back in the day, like back in the Brontosaurus day, oxygen in the environment was actually higher. It was higher than 21%. So the lower the oxygen level, the better it is for people, for the most part. But if it gets too low, then it's bad for you, obviously. But we've adapted to 21%. So you shouldn't be sucking on oxygen. Hey, there's an oxygen tank. Let's suck on it. Huh? Yeah, even then that don't really work. That's all psychological. Tell me you followed this, right? What I really want you to get from this, is that it is metabolism that dictates how much oxygen is delivered to the cells. Do you understand that? That the lower the PO2, the higher the PCO2, the higher the temp, the lower the pH locally at the cell, the more oxygen is unloaded from hemoglobin. Say yes. Guys?
Yes.
That's the oxyhemoglobin dissociation curve. Did you like that one?
You're gonna put that on the test.
Yeah, that one's going to be on the test. You had to know that, right? When you answered the question, what I want you to, all you have to think of is where do you want oxygen to bind to the iron on hemoglobin? You want it to bind in the lungs. What are the conditions at the lungs? High PO2, low PCO2, right? Lower temperature and a higher pH. All of those conditions allow oxygen to bind to the iron on hemoglobin. Where do you want the oxygen to let go? At the cell, right? What are the conditions at the cell? Higher temperature, lower PO2, higher PCO2, and lower pH. Did I say pH twice?
No. But
Oh, good.
that's all you want, pretty much?
Yeah.
Okay.
Do you understand that?
I get that.
Right.
Just with like
The right and left shift, right? You'll learn.
Okay.
Maybe.
Do we have to know? Do we have to put that in our answer then or no?
Just what he just said.
What I just explained to you. Do you follow that?
Yeah.
That's it.
Da-
That's it.
Watch. Listen to me. the reason I'm going over the right and left shift, look, it's not part of the competencies of the course. The only reason I'm doing it is every frickin' semester, I get a litany of emails from former students, can you go over the right and left shift? And I'm like, no. That's why I'm going over it, because then when you email me and you say, Tim, I don't understand it, then I'm going to say, no, I went over it. See, all I'm doing is saving myself work. Tell me you got that. That's the oxyhemoglobin dissociation curve. Did I explain how increasing or decreasing ventilation affects pH? Did I?
I marked that you did.
Guys?
You did primary functions, how it YB3, oxyhemoglobin.
I didn't go over it.
No, you didn't.
Okay, I'm going over it right now. Guess what it's going to bring back?
Oh, wait. I have that you
Yep,
I already did too.
Wait, I have that you went over it.
I did.
You said,
Did I go over it?
yeah, you went over it on the first day.
Let me see. Where?
3-2 at 6:47.
6:40.
At what time?
6:47.
Did I write this equation out?
Number 8.
You didn't write that out, no.
I didn't write it out. I'm going over it then. I don't care. I'm going to go over it.
Just go over it.
Right.
Do it.
Right. I'm going over it. Here we go. Man, we are struggling. Okay. What's the goal of the body? What's the goal of a chemical equation?
To balance pH of the body. Free to be.
You're just really random. You're just hoping. Right? Even a blind squirrel finds a nut once in a while. Right?
What's the purpose of this equation? Is that what you just asked?
No. What's the goal of any chemical equation? To be balanced, right? Equilibrium. Tell me you got that. Okay? She was excited too, like, hey, I think I'm going to be right. Okay, now it's no longer CO2. We know that it is PCO2. See, we're learning.
No, what's
Oh, good lord.
The P is the carbon dioxide dissolved in the plasma.
sorry.
Here, I'll use this little ray gun on you. Guys,
Does it matter?
We got it.
Does it matter with that for the equation? P and the PCO2?
no, but okay. Do you feel better if I get rid of it?
Yeah,
A little bit.
Yeah, you throw anything new, right? Anything new.
There's like when you flip the classroom. It was bad. That was a bad day.
Okay, we're having a bad day. All right, so watch. Watch. What system controls carbon dioxide? Okay, let me give you an example of this could in fact happen. April 21st rolls around, right? You go on WebAdvisor and you look at your final grade and you're like, you saw Harper Valley. So, that is so mean. That is actually mean. Okay, so watch. Why do we breathe?
To maintain the pH in our body.
Okay.
Get rid of CO2.
That's right, because of the indirectly the buildup of carbon dioxide, right? So if you start breathing more, blowing off more carbon dioxide than you're actually producing, right? You're sitting here, right? Then you look at your grade, gotta work with that, right? And you're like, and you start breathing out more CO2 than you're actually producing. Say yes. What's going to happen to the amount of CO2 in the blood?
Said I failed.
I'll say it again. If you're blowing off more CO2 than normal, okay. Were you just playing with me?
No, I said up. Because I was thinking if you're breathing more,
Don't here. I'm.
you're doing more in the metabolic
If the CO2 goes down, tell me you got that. There's less CO2 on this side. So you have to make less the hydrogen and bicarbonate. How do you make less of them? You combine them and lock them up in carbonic acid. So it will force the equation, right, this way. Tell me you got that. And when you get rid of free-floating hydrogen ions, what happens to the pH? It goes up. So hyperventilating raises your pH because you're blowing off more CO2 than normal. Say yes.
Yes.
Okay, good. Now, if you're hyperventilating, what do you do?
Get it back.
slap yourself.
Stop reading the textbook.
And get
That's a G, by the way. Like the devil. Straight devil. Start reading the textbook and get good grades. Then you won't hyperventilate. Yeah.
So earlier in the semester, you talked about what's the highest acidity you can get or before you get into seizures or alkalosis causes seizures. Like getting confused, right? Alkalosis causes seizures.
Yes.
And acidity causes coma.
Yes.
So why do people pass out when they hyperventilate so much?
What?
Not in the brain.
Wait. I know this.
Because they're now becoming more acidic, right? They're more alkaline.
You broke him.
10.3.
yeah.
He's broken.
Broken teacher.
You don't need to go. It's a rough day.
I don't know. I don't know.
Should we Google it?
I should know that.
But you know that, I mean, you know what I'm talking about.
Yeah, I know. Right. I'm thinking it may be compensatory, just to kind of the brain shuts down, kind of, just so that they don't continue to do it because hyperventilating for no physiologic purpose doesn't make sense.
Right.
So I think the brain kind of shuts you. I don't know.
I mean, I know that they get a couple fetal spasms, but and then they just pass out and reset.
It says.
I
Do you want me to read what it
yeah.
says?
Read what it says.
Hyperventilation causes the carbon dioxide level in the blood to decrease. This lower level of carbon dioxide reduces blood flow to the brain, which may result in the following nervous system and emotional symptoms: weakness,
Erica
fatigue.
was right.
Looks like we were right, weren't we?
Boom.
Yeah, but how does it reduce blood flow to the brain?
Well, because how does blood know where to go? Because of the metabolic components, right?
Well, you're breathing in less oxygen. When you're hyperventilating, you're breathing more CO2 and taking in less oxygen, so that's less oxygen to the cells of your brain.
Yeah, because it reduces carbon
Sounds
dioxide.
good. Just go with it.
Carbon dioxide, low CO2 is a vasoconstrictor.
So then it would constrict.
I don't know. We'll have to investigate that further.
Okay.
Because
I
not
don't-
enough oxygen is going to the hemoglobin, maybe?
No, because that would cause a left shift. So it would bind there. It just wouldn't let go. So maybe O2 delivery. I don't know. You know what? I'm going to look that up. I am. I'm going to find out.
Do you make a PowerPoint?
Yeah, I'm going to make a video on it. So I'm going to have a couple of my general students who I don't like hyperventilate. And then when they hit the hard tile floor. Did you ever hear that dead weight? You ever hear dead weight? Oh, that is the sickest sound.
Oh, dead weight fall.
Yeah. That's just, gives me the creeps. Okay. All right. All right. How many extra points did I get for you having a sinus headache? Okay. That's minus 10 for asking me a question. All right. Okay, let's move on now before you can think of another one. Here's the thing. I should know that.
Why don't you?
I don't know. But I should know that.
It's Friday, so.
All right.
You need to go home.
No, man, yeah.
All right, moving on.
Yes. Okay, so hyperventilating lower, you're going to explain it in terms of this equation too. I'm telling you that right now. Don't hate. Look, you're going to do it. All right. Then what if somebody sticks a dirty, dirty dish rag down your throat?
Build up.
So CO2 is going to build up. In order for both sides of the equation to be equal, the equation has to go this way. And what's going to happen to the amount of free-floating hydrogen ions? So what's going to happen to the pH? What's the only system that can compensate for a respiratory acidosis? And how would the kidneys compensate?
By sending more bicarbonate out to catch the free-floating hydrogen ion.
Right, so you reabsorb bicarbonate back into the blood. So bicarbonate in the arterial blood would have to increase. Tell me you got that. That's very important that you get that. All right, so I answered that question, yes? Mm-hmm. Okay. Now I'm going to, did I do the DKA question? I think I did, right? If your blood sugar was 1213,
Yeah.
why you would breathe more, why you get the Kussmaul breathing?
Yeah, you did a
Okay. Yep.
last time. He did at 6:45.
I did. I'll never forget it.
6:35 on what day?
March 2nd.
On March 2nd. Okay. There we go. Ready? Ready?
Wow.
Yeah, that teaches you. True or false?
False.
Good. When air comes into the alveoli expand. True or false? That's true, right? Is it moist and meaty or dry as a bone in there? Moist, right? Water causes things to stick together. When you're not reading the textbook and you had to turn a page, you go, right? Because water has a cohesive property. You got me? So watch. When you take a breath in, the alveoli expand. When you blow the breath out, there's a natural tendency for the alveoli to collapse. And because it's moist and meaty in there, the walls of the alveoli should stick together. So when alveoli collapse, it's called atelectasis. That's a good word. That would be a good first name. Hey, atelectasis. Are you reading a textbook? No. How many people are with me? So when you breathe out, do your alveoli collapse? No. That's because embedded in the membrane of all of your alveoli are specialized cells called, better write this down, better not pout, type 2 alveolar cells. And these cells secrete a substance called surfactant. And basically what surfactant does is it prevents the water molecules in the alveoli from sticking together. If the water molecules don't stick together, the alveoli the walls will not stick together. Say yeah. Babies don't start producing that until the 7th month of gestation. Fetal lung development is complete except for surfactant. That's why when babies come out, right? The doctor slaps them on it. What the, right? And when they blow that breath out, if they're preemies, because they don't have surfactant, the alveoli stick together, they develop atelectasis, and they go into respiratory distress. So they have to be intubated, and then they have to be put on a little baby ventilator to keep those alveoli open. And if they know the baby is coming early, right, because, you know, maybe the mother has a final and advanced AMP at Gateway, the doctor will can give the mother an artificial surfactant. It's called Surfacan. Have you ever heard of it? It's actual surfactant. It's a chemical that will stimulate the production of surfactant in feti. If the baby comes out early, right, and it's not known, and they run into problems, then if they have to be intubated, they can put Surfacan down the ET tube so the baby doesn't have to be on the ventilator that long. The longer that baby is on the ventilator, the more likely they're going to have respiratory problems as they get older. It's just the way it is. You got me? So also, watch. They will add. What's that? Yeah, but for babies, yeah. I mean,
Well, more serious for babies, but kind of overall.
yeah. If you ain't strong enough to breathe as an adult, you're in trouble. Yeah. What?
How early can you put surfactant in? Or
I don't know. I don't know.
Okay.
All right. You didn't get any extra credit, did you? So that's just a straight minus 10. See, Chris broke even. Watch. There's this, when they're placed on a ventilator, they're also placed on what's called PEEP. It's those little marshmallow things, and they just cram them down the ET tube. PEEP stands for positive end expiratory pressure. So watch. When you blow the air out, you want to get the air out, right? What do the alveoli do when you blow the air out? They collapse. You want little babies' alveoli collapsing. So as they're breathing out, the machine puts a small amount of positive pressure so that their alveoli don't completely collapse. That's called PEEP, right? But what happens to the pressure in the lungs as a result of that PEEP? It goes up, right? Because you're putting air into it. So what's going to happen to venous return? It's going to go down, right? Because you got to create that difference in pressure. That's why you have to monitor people's cardiac output when they're on PEEP, because they can start going into cardiogenic shock with that. Say yeah. You followed that. So I answered that one. Let's see what else. Oh, okay, you're going to like this one. Did I do the chronic bronchitis? Okay, here we go. Write this down. Chronic bronchitis. You get chronic bronchitis from smoking the chronic. Anybody smoke the chronic today? No? Brittany's over there. She was sitting downstairs, man. She must have ate like 10 bags of Doritos. Anyways, here we go. This is actually kind of cool. I told you the story behind this, yes? Do you know what a refrigerator nurse is? What's a refrigerator nurse? The only one that only works to get a new refrigerator. I worked with one, right? And this lady came in. She was portly, overnourished, yes? And she was having a hard time breathing. So the refrigerator nurse puts her on the gurney, right? Elevates her head, which was nice. And then slaps on a nasal cannula and turns on the oxygen and then walks out. And I'm busy. I got my own patients, right? So I'm walking past the room and I see the lady and she's like, okay. Then like 10, 15 minutes later, I walk past the room and I see her like this. And she's like this, watch. So I had a watch on and I counted. She breathes twice in a minute. That's bad, right? So I go, that ain't right. And then I went on break. So I looked at her chart. It said chronic bronchitis times 20 years. So I go and I look at how much oxygen was flowing. She had her on like 6, 7, 8 liters. I don't remember. And I turned it down to 2, and she woke up. Ready? Here's why. This is an NCLEX question, and if it's not an NCLEX question, tell me that it wasn't, and I'll give you $10. Okay? They love talking about this. What's the drive to breathe? Right, indirectly CO2, right? Hydrogen ions directly, we learned about that, but CO2 for right now, right? So normally, what is this? No, it's a guy walking around in big furry slippers.
Were you talking about bronchitis or COPD?
Chronic bronchitis is COPD. All right, so watch. Chronic bronchitis, watch. The hallmark of chronic bronchitis is paralyzed cilia and hypertrophy of goblet cells. What does hypertrophy mean?
It's shriveling and
No, that's atrophy. Hypertrophy means it gets bigger, right? So these people got giant goblet cells, and what do goblet cells produce? Mucus, right? So these people, you ever hear a smoker cough in the morning? Then they turn red. Look like they're going to die. But they don't. So basically they have this overproduction of mucus and inflamed airways, primarily the main stem bronchi and the bronchioles. So I'm saying this green stuff is mucus. Ooh, googery. Say yeah. The problem with people with chronic bronchitis is there is a ventilation perfusion imbalance. With normal people with normal lungs, we only ventilate or only perfuse alveoli that we ventilate. That would only make sense, right? Why would you want to send blood that doesn't participate in gas exchange? Say yes. But in people with chronic bronchitis, there's this imbalance. So what's happening is they are sending blood that's high in CO2, right, and low in oxygen. Can oxygen get into this alveoli? No, because it's got a big, giant green booger blocking it, right? So will this alveoli be able to participate in gas exchange? No. This alveoli, right, it's open, so CO2 comes in, oxygen comes in, right? Say yes. So where does all of that blood that went through gas exchange in the lungs, where does it go to? What part of the heart? Left side of the heart. So what's going to happen to this person's overall level of CO2 and oxygen? What's going to happen to the CO2 levels in the blood? They're going to go up, right? Because you're not able to get rid of that CO2. What's going to happen to their O2 levels? They're going to drop. And if your PO2 drops and your PCO2 goes up, if your PO2 drops, what's going to happen to O2 saturation? It's going to go down. O2 sat drops, right? Because O2 sat is dependent on PO2. If PO2 drops, O2 sat's going to drop, right? So what happens over time to these people is the medulla becomes desensitized to high levels of CO2. These people don't breathe because of high levels of CO2 anymore. Do you understand that? But you learned, and I'll never forget it. It was a Tuesday. Yep. 7/27. Remember, it was like yesterday. Remember it like it was a week ago. Hang on.
How long did that take for your patient that you were talking about?
To desensitize, it depends on how bad it
No,
is.
sorry, to knock out or respiratory drive.
I don't even know. I was kind of making up the numbers. I don't know. It could have been an hour. Could have been 10. I don't really remember. But here we go. Watch. Why do people? What happens to PCO2 levels in people with chronic bronchitis? They go. Wait. Say up. Good. PCO2, right? It goes up. What happens to PO2? Do you remember, I'll never forget it, we talked about the fact that there are peripheral chemoreceptors in the arch of the aorta and the carotid arteries, right? We talked about this. And they are particularly sensitive to low PO2, low pH, and high PCO2. Over time, these chemoreceptors, both peripheral and central, become desensitized to that high level of PCO2. They now perceive it as being normal for this patient. You got me? And these people now breathe due to low PO2. So what's the stimulus to breathe in people with chronic bronchitis? Low PO2. So if you have somebody who has chronic bronchitis and they're breathing due to low PO2 and you slap them on a bunch of oxygen, when that oxygen, that extra PO2 hits here, it will stop their stimulus to breathe. They'll say, hey, I got plenty on, I don't need to breathe. Tell me you got that. So they are driven by low oxygen as opposed to high carbon dioxide. That's why you have to limit the amount of oxygen in people with chronic bronchitis.
There's no way to fix that?
No. Once you have chronic bronchitis, you got chronic bronchitis. It's chronic. We're smoking the chronic. Do you want to smoke the chronic?
No, I don't do that.
No, I think April did. She had that look like, So yeah. Guys, I answered that one too, right? That was real good. Okay. Oh, number 16. Number 16. Yep. Better get your pen ready. That will be extra credit. I got a nice little video on pulmonary function testing and how to interpret it. Listen up, because this is true. If you want to do the multiple choice, you can do this too, the extra credit, pulmonary function. You got me? And it will be worth 100 extra credit points. Yeah, so that'll be like if you screw up on, 4 or 5 questions, you can probably still get a D. Say yeah. Okay. And did you watch the asthma video? No, you didn't.
I have asthma.
Who watched the asthma video? You did?
No, not yet.
Not yet.
Oh, that's a good line now. Not yet.
Are you going to go over 16 and we're just watching?
No, you're going to watch the video on 16 if you want some extra credit. I suggest you watch it.
Okay.
Yeah? I'm going to go over asthma really quick. Okay, hang on. Where am I? Anybody here have asthma?
I do.
Do I get extra credit for that too?
No.
Oh.
If you can go into an asthma attack right now, I'll give you extra credit.
I could probably try to run a mile and I can come back.
Same.
You have exercise-induced asthma? Yeah. That's the mildest form of asthma. You ain't
And
getting
when I
any
got
sympathy
blood
here.
drawn to check that.
When it gets cold out too, you have a hard time. Yeah.
It's terrible.
Yeah. Cold, dry air. Okay, here's dude. He's got some bongos. Right? Okay, now write this down. It's in the video. It is word for word. Watch. Asthma is an allergy in your respiratory tract. People with asthma have allergies. This is one time the body does something that doesn't make sense. That's one time. An allergy is an exaggerated immune response. Your immune system is overreacting to something that it shouldn't overreact to. And what is the primary function of the immune system?
To keep you healthy.
Yep. Nobody watched that video.
S. Really?
Yep.
A.
Inflammation.
What happened to Timmy? I wanted to solve the puzzle. The job of the immune system is to produce inflammation. Inflammation protects you.
We said protect.
You didn't say. You didn't say. That's how it protects you. Inflammation.
But you didn't say.
Okay, watch. How many people have ever hit their hand with a hammer? Well, you shouldn't do that, Joe. I know it does. If you hit your finger with the hammer, it's going to hurt. Ouch. And what's going to happen to your finger? It's going to swell. That's inflammation. Say yes. Inflammation, you better write this down, is produced by massive arterial vasodilation. And if the arteries dilate, they carry nice, warm, red blood, so that area becomes.
Could have a pulse.
Okay, yeah, you're reliving the cardiovascular. Huh? Okay. Do you got that? And I said it. I say it every time, and I know I did. And you can never deny it. I told you that the lining of the respiratory system is very vascular. Didn't I tell you that?
You did.
Okay. I know, I'll never forget that. I always make sure I do that. Okay. How do you want air to flow in the lower airways? Lower airways. No, we got that. It's cleaned. Luminarly? Yeah, you want it to have light up.
In lane.
In lane. Laminar flow. Yeah, wow. Yeah. I'll tell you what, you got pulled over by a cop and he said, hey, how does air flow through your bronchioles? And you're like, and I won't give you a ticket. You're like, you know.
You got pulled over last night. You got pulled over last night? Yeah. For what? My headlights out.
Where'd you get pulled over, in Mount Pleasant?
Twin Lakes.
Oh.
I didn't know they're around here at all.
I know a bunch of Twin Lakes cops.
I don't.
I do my best drinking over there. Yeah, because when they pull me over, hey Tim, we know you. We don't even have to get your information. We'll just cart you off to jail right now.
If you go down
I said, thanks.
past the gas station.
Why are you talking about some gas station? I'm doing this.
You were talking about the bars you go to.
Yeah, well, big wow. I don't go to bars. Why ain't my colors working?
Because you just yelled at me.
I bet you're right. All right, this will have to be the color. Well, that ain't no color. All right, here we go. Right? This little circle represents blood vessels. Say yeah. You got me? In the lungs, the the blood vessels have beta 1 receptors, and when epinephrine binds the beta 1 receptors in the arteries that line the lungs, what do the arteries do? They constrict. Not even playing. The bronchioles are made of muscle. What are the two things muscle can do? Yeah, contract and relax. The muscle cells that make up the bronchioles have beta 2 receptors on them. Tell me you got that. Okay, so here we go. Watch. How does what's the primary function of the immune system? Produce inflammation. How does it do it?
Vasodilation.
Massive arterial vasodilation. So watch. If you are allergic to cats, anybody allergic to cats? People have cats here, and when you hand in your quiz and I grade it, I start wheezing. I take points off. So I'm allergic to cats. So if I see a cat, right, and I say, hey cat, here, kitty, kitty, I pet it. Right? And then the cat hair balls go flying in the air, and I go, and I suck one in. And to show you how terrible this is, I'm going to make this cat hair ball that big. That's a big cat hair ball. I'm allergic. So the immune system is going to cause what? It's going to overreact and it's going to produce what? Inflammation. So what's going to happen to all of the arteries that line my bronchioles? They're going to dilate. Right? The arteries are going to dilate. So what's going to happen to the size of that opening that I can breathe out of? It's going to get smaller. And goblet cells are stimulated, so you get mucus. Say yeah. So how are people going to breathe? Because the resistance to airflow has gone up, so airway pressure has to go up. And how do you create a greater difference between the atmosphere and the lung? Create a greater lung volume. So you go, that was a good one. I should be an actor for asthma. Guys, how many people are following this? The other thing is that you get extravasation of leukocytes. I know, you're all looking at me like, wow. That's right, that was impressive. All you need to know is that you will start to get that immune response. White blood cells will start going to that area. And white blood cells release a chemical called leukotrienes. And leukotrienes will stimulate the smooth muscle of the bronchioles to contract. So what will happen to that airway now? It will get even smaller. So these people will be wheezing because the bronchial, it's not all muscle, so you see it's kind of in columns. So normally the air flows in a layered fashion, but due to the spasming of the muscles, air will begin to flow turbulent, and turbulent airflow produces wheezing. Tell me you got that. So what do you give these people? You give them a sympathomimetic, a medication that mimics the sympathetic nervous system. And what's the hormone associated with the sympathetic nervous system? Epinephrine. Say yes, epinephrine. Good. So you will give them a drug called albuterol. Okay, now think about this. Think about this. When you're scared, what happens to all of your arteries throughout your body? Say the opposite. They constrict, right? Because what you want to do is you want to prime that pump, right? You want your heart rate and your blood pressure higher, and you want all of your arteries to constrict. Because when you start running and I prefer to run because I could get hurt. Where am I metabolically active? Arms and legs. And I'm going to produce byproducts of metabolism that are going to override the effects of epinephrine. Say yes. And it's going to open them up, and when the little left ventricle contracts, arterial blood always takes the path of least resistance, yes? But the non-metabolically active parts are still under the effects of epinephrine. So those arteries are massively constricted. That guarantees that the vast majority of arterial blood will go to your arms and legs exactly where you need it. Say yes. What does epinephrine do to your bronchioles?
It dilates them, so you need more air in.
That's right. That's exactly how you should have said it. You put your feet up and discuss.
And that
You
was
see that?
sassy too.
Yeah, that was an attitude right there. I like that. Do you need to get more air in or out when you're running or fighting for your life?
Yes.
So do you want your bronchioles to constrict? You're like, okay, buddy. Ready? So you want the bronchioles to dilate. So when epinephrine binds the beta 2 receptors in the smooth muscle, it will cause the muscle to relax and cause bronchodilation. Say yes. So, we learned those in the cardiovascular system. I'll never forget it. Remember I talked to you about a beta adrenergic agonist antagonist. Remember that? So in this case, is epinephrine an agonist or an antagonist? It's an agonist. It stimulates. Say yes. So if somebody has asthma, do you want to give them a beta adrenergic agonist or antagonist? You want to give them a beta adrenergic agonist. And the medication they give is albuterol. Say yes or roll. So watch. All I got is yellow. My thing ain't working. So you have beta 1 receptors on these yellow arteries. And when you take a hit of albuterol, you shake it up, hit it, here, right? And that will stimulate beta 1 receptors in the smooth muscle of the blood vessels, and it will cause them to constrict. So what will happen to the airway? It will open up. And beta 2 receptors will cause the bronchial muscles to relax, so what will happen to the bronchioles? They will dilate. Tell me you got that. What are the side effects of an albuterol inhaler?
Shaky, nervous, bad.
Because they mimic epinephrine. Say yeah. What caused this whole mess?
Inflammation. An allergy.
Right, an allergy, which is an exaggerated immune response, right? Do you want your immune response or your immune system to overreact all the time? What suppresses your immune system? So they give you a steroid inhaler too, Pulmicort. Do you see that? Now watch. It takes about 3 to 4 weeks of continued steroid inhalation to adequately suppress the immune system. So what happens? The parent brings the kid in, Joey can't breathe, right? So they give him an albuterol inhaler, maybe they give him a little Solumedrol, right? And then they give you a med dose pack, a little prednisone, right? Step you down. And then they say, here's a Pulmicort inhaler too. But once Joey starts feeling better and he ain't taking his albuterol anymore, he stops taking the steroid inhaler, and the same thing happens. You need to continually take that steroid inhaler to continually suppress the immune system.
Next question.
Yep.
If a kid's on that long enough, can it lead to like type 2 diabetes because of the steroid thing?
No, you know what? At that dose, the amount of that, it's really small, and they try to localize it in the lungs, so the systemic effects are not going to be as great. If he had to take like oral prednisone the rest of his life, yeah,
No, okay.
yeah.
I was worried about that.
Yeah. Watch. Why did they tell you to rinse your mouth out?
It builds up bacteria.
Why?
Because I'm stupid.
When you're breathing it in, it gets stuck on the back of your mouth.
Yeah, but why do they tell you to rinse the mouth out?
They do tell you.
Well, because if you're taking a steroid that's going to suppress your immune system, then the immune system still works in your mouth. And if it's not suppressing the bad bacteria that's in our mouth, then you gotta rinse it out.
Right. It suppresses the immune system locally then. And it will suppress it enough where you can't fight off anything and people get thrushed. They get a fungal infection. That's why they tell you to rinse it out. Say yeah.
Yeah.
Then there's another one. What caused the bronchospasm? No, the bronchospasm. What caused the bronchioles to constrict?
The muscle. Oh, the leuko.
The leukotrienes. Very good. Right? So do you want leukotrienes being released from white blood cells causing the bronchioles to spasm? No. So there's a drug out there called Singulair. You ever hear of it?
Yep.
Singulair inhibits the synthesis of leukotrienes in white blood cells. So it works as an oral bronchodilator or bronchoconstrictor preventer.
Yep.
Tell me you got that. Now, the newer steroids they've come out with the last 10 or 15 years, Advair. You've heard of Advair?
Yeah.
Advair is a long-acting bronchodilator and a short-acting steroid. So this steroid that you inhale along with the long-acting bronchodilator will begin to suppress the immune system within a few days. So that's why Advair, they're using Advair much more. Tell me, yeah.
Yeah.
That is, of course, asthma. Now watch. Where do you have beta receptors?
All kinds of places.
Oh, right, that's a good answer. All over the place, right?
Yeah.
And you have beta 2 in your smooth muscle, and you got beta 1 in your yellow arteries, right?
Yeah.
There's a drug out there called Inderal. We watched beta blockers with Joey Bag of Donuts, and he tried to explain this. Now I'm going to explain it to you, okay? Inderal is a non-cardioselective beta blocker. It blocks all types of beta receptors. Where do you got beta receptors? Yep, and in this picture where you got them.
The smooth muscle.
And in the blood vessels, right? So if you're taking Inderal or a high level of cardioselective beta blockers, then that can still block some of the other beta receptors throughout your body. So if you have asthma, beta blockers have to be used with caution, because if you block beta 2 receptors, say yes, then you start having an asthma attack, can albuterol bind to a blocked beta 2 receptor? No. That's why those beta blockers are used very cautiously in people with asthma. Say yeah. See? That was good. Did we do them all?
No.
What do you mean no?
All the questions.
Yeah.
No.
What's that?
13, 15.
Oh, okay. Okay. I did cystic fibrosis.
Oh, you did. I mean, yeah. I guess.
Do you do the quadriplegic have to be a
Oh, that's simple.
You did.
Here. Did I do that? Quadriplegic?
The fronted nerve not allowing the diaphragm.
Right.
Oh.
Right. C3 and C5?
Yeah.
I told you that, right? C5 still alive. You've heard that?
Yeah, he did do that. He did. It was very short.
And
It was
you
when
do
he
the
was
whole
talking
people
without
eat.
breathing.
And
It
you
was
talk
a nap.
around.
Yeah.
That's what it's all about.
It was the first day. Did you do CO2 kills?
Yeah.
Obvious.
Chris, do you want to come up here and explain how CO2 kills you? You probably know it better than I do. Yeah. You know that. Don't you have to go like teach people how to put in CO2 things?
Yeah, so it's pretty elementary because it's like casting through the bowls and stuff. I don't know what you do, but
I can't hear you.
You're he's gonna let you do
He
it.
said for you to just share it.
So it just, essentially it blocks the ability of hemoglobin to carry oxygen.
Yeah. That,
Because it's got a higher affinity for hemoglobin than oxygen. So if CO2 is jumping on the hemoglobin plus, then there's no room for oxygen.
yeah, you notice how you use the word affinity. Yeah.
Yeah.
I don't use that word. Yeah, that's a big word.
What word did you use?
You did use that word. You did use that word.
Oh, did I?
Yeah, we were
Okay. Okay. So minus 15 group. Hate. Okay. Which is heavier, CO2 or air? Or which is heavier, carbon monoxide or air? Heavier?
I would say so. It sinks, doesn't
It
it?
feels like
No.
it would be.
That's why, like in the miners, they used to have birds that would hang up, right? And then the bird would go chirp, 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 and then they knew to get out of there because carbon monoxide was building up. So carbon monoxide is lighter than air. Sometimes they would hang up like general A&P students that weren't doing good. Yeah, hang them up. Right? So, watch. And Chris is exactly right. Here we go. Carbon monoxide is colorless and odorless, so you don't know you're being exposed to it. Okay? Carbon monoxide and oxygen compete for binding of iron on hemoglobin. You got me? Now watch. Watch. When oxygen gets down to the cell, what does it do? It lets go of the iron, right? It goes into the cell. When carbon monoxide binds, it don't let go. So every time that red blood cell circulates, oxygen and carbon monoxide are going to compete. And there's going to come a point where you simply can't bind enough oxygen to send to the cells of the body, right, and the brain, and you will become unconscious. And if you're not removed from that situation, you will die. You will asphyxiate yourself. You will not send oxygen to your brain, and you will die from oxygen deprivation to your brain. Say, yeah.
So you want to give a person oxygen.
Right. So remember, and I think I told, no, maybe I didn't. Anyways, about 6-7 years ago, in my classroom, there was a dude who had his seat. So one student came in, and it was like this time of the semester. So like everybody, you've established your territory, right? So some student's sitting there, and he's like doing one of these numbers, right? He's walking back and forth, right? And I'm sitting in my little chair, and I'm like, is there a problem? I'm sitting in my chair. I'm like, could you move? No. The student said, no. I'm like, you're kidding me. So he goes like this. He backs up, and he starts charging at her. And I'm like, anyways, here's my point. When someone's exposed to carbon monoxide, it's like somebody sitting in your seat. You got me? The amount of oxygen in the air has not enough pressure to push that carbon monoxide off. So here, I'm going to, right? So this is the pressure of the air, your carbon monoxide. She kind of looks like carbon monoxide. You got me? So the firemen come and they throw you on a mask that's 100% oxygen, right? So then it gets right?
Yeah.
So the higher pressure track, if that doesn't work, then they take you to a hyperbaric chamber where they crank up that oxygen to like 6-7 times the normal PO2. And that is like, boom, right? So that pressure is going to push that carbon monoxide off, and then they will exhale the carbon monoxide. And then you can actually tell if it's working because the people there's carbon monoxide detectors, and they can detect the removal of the carbon dioxide. Here's the weird thing. You ever see somebody die from carbon monoxide? I've seen a couple of people. These people look so good, but they're dead. When carbon monoxide binds, it causes the blood to turn red. So these people got rosy cheeks, their lips are all red, but they're dead. That's how carbon monoxide kills you. So,
How long do you have to be exposed for
It depends on the amount.
Like if you were at home sleeping in your house.
It really depends on the amount, right? So that's why they tell you now, like now with the newer furnaces, the high efficiency, they got that exhaust coming out of the side. Make sure that nobody goes there and puts textbook pages in there and clogs it up, or snow and stuff like that. And you got to make sure those things are working. So if you got birds or stuff hanging up, and all of a sudden your bird starts throwing up or like falling off his perch, you need to get your fatty acid out of there. Say yeah.
Yep.
Right? You don't want that. And the thing is, when you inhale, when you get too much carbon monoxide in your system too quickly, you throw up, right? So you don't kill yourself by putting a hose in the tailpipe, right, and then put it in your window, right? That way too much carbon monoxide. Just sit in your garage, turn on the car, and then just listen to Stairway to Heaven. Right? What? I've told you how to kill people here with like potassium and stuff. Yeah, you know what? Watch. Me telling you that, and then that's a good idea. I'm gonna go do that. Look, cut it out. All right, ambulate. Okay, hey, listen up, because this is true. Listen up. On Tuesday, we're going to start the kidney. You got me? The kidney is no joke. The kidney, nobody likes the kidney. The kidney's like the stepchild of the body. Nobody talks about it unless it goes bad. You got me? You got to know that. The kidney is a badass. You know what I'm going to do now?
Go drink.
No.